Good evening, everybody, and welcome to another session with the Kidney Warriors Foundation. Yes, on COVID Talks. Yes, in association with Biocon Biologics. Today, we'll be talking about managing transplants successfully. We have many surprises for you this evening, but first, let's welcome our doctor. Welcome the director and head of nephrology of Max BLK Hospital, New Delhi, Dr. Sunil Prakash. Hi, sir. Lovely to have you with us this
Hi,
evening.
my pleasure. I didn't deserve such a elaborate introduction. So, friends, it is my pleasure to talk to you. We all are very passionate about transplantation. In our mythology, the first god you worship is Lord Ganesh, and he is the icon of transplantation. So, all my transplantation patients for me are like reminiscences of Lord Ganesh. You are very important people, and stay like that. Never lose hope. So why are the kidneys getting hit so often nowadays? It is mostly because of obesity, high blood pressure, diabetes, and heart diseases. And the poor kidney is like a sink where it gets hit. So what can we do about a patient who needs a transplant? In India, we do mostly live-related transplant, where a relative gives one. Earlier, India was notoriously famous for paid unrelated transplants, but big hospitals now don't do it. We want to promote with the help of people like Anjali brain stem dead programs, people like Biocon, Anjali, and so many others, kidney warriors. Then we also do transplant across the blood brain. Earlier, you could not transplant a B blood group into O or vice versa. You could not do B into O or A into O, but now we can. That is called ABO incompatible, and then we can also go across HLA barrier, which is very formidable. And then a word about xenotransplant. What about getting a kidney from an animal? Friends, let us recapitulate history. First successful transplant, December 23, 1954, Boston, USA. One brother gave to another, Dr. Murray, who did it, got the Nobel down the line. These are some transplant historical scenes. We are very proud of such pedigree. And eventually, I show this slide with a lot of passion. You see, after giving his organ, Ronald, the donor, participated in World USA Transplant Games 50 years after giving his one kidney to his brother. The point I am trying to make here is that if a donor is worked up correctly, his life is never reduced. And Ronald lived to a full useful life. So first thing for a transplant is we need to counsel the patient, the donor, and all patients can give from 18 to 65 years of age. Anybody can give who is a major and who is not very old. So this is the age range. And there is a proper sequence of tests for donor and recipient. We have to do them very properly. We are governed by Hippocrates. Nocium nos harm, do no harm. Donor should not be harmed. And as I showed you earlier, that Ronald lived for more than 50 years. Now, this is a very comprehensive list. I will certainly not go into it. But all I'm going to say is that age I have discussed, donor should be free of medical any illness like kidney, heart, and there should be no greed, misinformation. Donor should not be misinformed, and no coercion. Then lot of evaluation is done, and we do HLA, we do cross match, tissue typing, PRA, and eventually all the reports are collected and they are analyzed by the transplant team. And then further workup are done. See, you see such a big list. I will certainly not go into them, but suffice to say that donor is thoroughly combed, his cardiac evaluation, his abdomen, his kidneys, both kidneys are seen, their fractional working is seen, and then psychiatric clearance, cardiology clearance. Then there is a donor advocate. He advocates the donor. He tells them why he should not be giving the kidney. He checks that the donor is fully cognizant of what he is doing. Then finally, anesthetic clearance, tissue HLA typing, and on. So once everything is ready, all these records are put up to the committee. The committee meets on a stipulated time, and they are looking at the records. It's a very serious matter. The cartoon shows that these are enjoying, but the committee meetings are very, very serious matters. People who have faced it, they know it. And eventually, hurrah, if you are approved by the committee, it's through. And then we go for the transplant. Obviously, some religious stuff rolls in there. I want to do on this date, that date, but whatever. Now, I want to just tell you that science has now overcome the blood-brain barrier. And as I said earlier, We can put A into O, we can put AB into B, and whatever. This has been made possible by very special drugs and by very specialized techniques of removing antibodies from the patient. This slide just shows how the antibodies are removed. This is plasmapheresis, and this is the whole gamut of regime, which starts from -15, and then it goes down, and then this is the time where the antibodies are reduced to less than 1 to 16. Transplant is done, and the patient is followed up for reappearance of the antibodies which are not friendly to that patient's transplanted kidney. And the surgery goes on, the surgery is done. This is how now we are doing with laparoscopic. So the donor does not have a big scar. The kidney is taken out, it is put on the ice, sluice, it is cleaned thoroughly. Every speck of RBC is removed from the kidney. So on the table, the kidney will look absolutely pale white, even still more paler than this. And then the kidney is taken in the tray to the donor recipient. And there the anastomosis is done. Artery is tied to this external iliac, vein which will bring back the blood from the kidney to the internal iliac, and the ureter to the bladder of the patient. And the kidney, friends, all transplant patient knows, are put in the right inguinal region most of the time. We don't open the abdomen of the patient, we just put it outside. So from patient's perspective, the surgery is simple. Donor removal surgery is more painful and intricate. Then patient stays in ICU in separate HEPA filtered room with separate ventilation. Donor stays for 5 days in our hospital. Donor also stays in these HEPA filtered rooms. Continuous IV is given, monitoring of continuous parameters, cardiac monitoring is done. Most importantly, we are measuring urate output minute to minute, hour to hour, along with any drains, if any. The urine output, we call it liquid gold. The more the urine the patient produces, the more happy everybody is. And once the patient is out of the ICU, we give them generic advice not to be very friendly in the initial few weeks. And something like what COVID has done to all of us. And they should have very few visitors. You know, India is sinister for having a lot of relatives and friends coming as well-wishers. And then there is always a chance for donor to get, for the patient to get infected. He should never ever forget his medications. We recommend that he put alarm on his watch or whatever for the time which his transplant medicine should be taken. He should be very religious about taking his medicines. And after transplant, if the recipient is doing well, they tend to put on weight. They tend to get diabetes also. We call it diabesity. They should be very careful. They should follow a healthy advice, normal diet, which low fat, I would say, only because it has a proclivity to give them fat and diabetes. So regular checkup once a week for first 6 weeks, then once a fortnight from 3 to 6 months, then once in 3 weeks for up to a year, and then once monthly we want to call them up. Tests are basically simple. All our patients know that creatinine is the important test. They wait for the bated breath for the test result to come before they roll into my room. And we also do hemoglobin TLC and urine just to see there's no side effect of the transplant medicine. And sometimes we do tacrolimus or cyclosporin level. And if there are any issues, we do certain tests in that particular direction. Once in a while, do lipids and bone scans also. So I repeat, patients should follow their blood pressure records at home. They should take their blood sugars with glucometers. They should take their weight and keep a record of intake output. I said they should not overeat. They should eat more of fruits, vegetable, PUFA diet, which all people want to take if they don't want to put on weight. Food safety and preparation is very important. This itself is a topic I will not be able to go into detail. Suffice to say, I tell my patients, they should eat only fresh food, and they should avoid eating any food which is not enough heated or enough. For example, they should not take these salads and curds, especially if they are prepared outdoors, because they will sometimes give them a very bad diarrhea, and that may bring grief to their kidneys. Obviously, please don't smoke, please don't drink alcohol. They should become physically active. In India, I'm afraid recipients are very worried. They don't want to overstrain, but it is not like that. Obviously, we don't want them to go bungee jumping, or we don't want them to do F1 or wrestling or whatever. But they should take good exercises like brisk walking, cycling, and even swimming after some time can be done after 3 months. All these will also have bone disease prevention. They can resume sexual activity after 6 weeks of transplant. And a word about contraception and pregnancy. And this is the slide which I want to show how a patient can maintain ideal weight. 5-foot person should be weighing 50 kg, and you can add 2 kg for every inch. So 5 feet 6 inches should be weighing 62 kg. And a kg here or there, they must try to maintain their weight. And roughly they should take about 4 teaspoonfuls of fat, which can be 1 spoon of asli ghee, 1 spoon of mustard oil. But trans fats and dalda or hydrogenated fat should be totally avoided. This slide just tells you the amount of calories a particular food has. These are like your dal has about 150 calories, 4 chapatis have 100 calories and things like that. All I want to emphasize here is look at these food items: hamburgers, chole bhature, sizzlers, halwa, and ice cream. We sometimes just nibble through ice cream, and the amount of the calories they take are 400. And look at this. These are high calorie bombers, but if you eat normal Indian diet like vegetables, fruits, even rice, roti without ghee, calories are all are less than 100. So in 2 ice cream scoops, you will get more calories than what a proper average Indian vegetarian meal will give you. So you have to be careful. And you cannot be living to eat, you have to eat to live. So some do's for my patients: they can use paracetamol for pyrexia as well as for body aches. And sometimes we give them dextropropoxyphene, but they should not take Voveron, Brufen, Nimesulide, especially if they are on BP reducing medicines like telmisartan or enalapril. Antidiarrheal they can have once in a while, but they should inform their nephrologist. They can have vomiting medicines like MCED, ranitidines. Pentoside should be taken sparingly, and the anti-allergic medicine they can take ad lib, but they should be prudent about the cause. They should not just take and forget to investigate the cause. And then some don'ts. Please do not ignore your trivial symptoms, because the patient does not get classical symptoms of a normal person. They may get less fever, less WBC count, but they may be having more severe pneumonia. And sometimes the drugs can be given injudiciously, which will interact with their transplant medicines. We tell patients not to drink grapefruit juice at the time of taking tacrolimus, and they should not take all vaccines, but they must take COVID vaccine. There is no controversy about this. Please take COVID vaccine. COVID is very, very sinister. I have lost many transplant patients in second phase of COVID. Pregnancy, a woman can go ahead after 2 years of successful engraftment, but even after successful delivery, we avoid them to breastfeed. So the statistics worldwide show that at 1 year, if the patient has been done well, 95% survival of patient and 88% survival if he has got a cadaveric kidney. But live-related survivals are much better. 1 year, 98% for patient and 94% for the kidney. So friends, if you have got a good kidney, at 1 year, 94% people will be having a good renal outcome, and 10-year survivals are around 60 to 70%. Then this is about a patient who gave birth to a child after 3 years of transplant. Now about 7-8 patients all across the globe, in Bangladesh, in Tanzania, in Iraq, where my patients have successfully born children who are normal children. It is very gratifying for us. As well as in India, we have a couple of patients. So friends, finally, I want to tell you, future may beckon xenotransplantation. This is if you can get a kidney or a tissue from an animal, and the animals which are being worked upon are pigs, chimpanzees, and but there are certain things we need to worry about, like you have seen what COVID has done. COVID has probably come from some animal source. So many diseases can be given to human beings. Rejections are much higher if you take a pig kidney. There are health concerns. You have to do better cloning. There are ethical issues. I wanted to recite this poem. This is about cadaver kidney, but I will not, because we need to talk to our patients But this is a lovely poem. At some time, I would like to go through it. And I think I will stop here. And this is where we work. And Anjali, I will live forever. The day will come when I will lie upon a white sheet in a hospital. At a certain moment, a doctor will determine that I am brain dead. When that happens, please do not attempt to instill artificial life into my body by a machine. And don't call this my deathbed. Let it be called the bed of life, and let my body be taken to help others to lead fuller lives. Give my sight to the man who has never seen a sunshine or love in the eyes of a woman. Give my heart to a person whose own heart has caused endless days of pain. Give my liver to the teenager so that he may live his grandchildren play. Give my kidneys to the one who depends on a machine to exist from week to week. And burn what is left of me and scatter the ashes to the winds to help the flowers grow. If you must bury something, let it be my faults, my weakness, and my all prejudices. Give my sins to the devil, give my soul to the God. This is.
So remember, please, 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 if you can give an organ that you can share, part of your liver, part of your kidneys, I mean, one of your kidneys, please donate it while you're alive. That is so important for the person next to you. But array, जब चले जाएंगे तो चले जाएंगे ना. We're leaving our clothes behind. क्यों? Why will we leave our organs behind? They're extremely precious for you. Thank you, Biocon Biologics, for being with us and hosting these COVID talks. Thank you, Dr. Sunil Prakash. It's been